Hip replacement surgery is one of the most successful and effective treatments for people with hip pain and stiffness, for people with arthritis or other forms of hip joint damage. It can be a daunting procedure to consider, so it can be comforting to better understand everything that's involved in having a total hip replacement. In this video, I'll quickly talk you through the anatomy of the hip and explain what to expect before, during and after your total hip replacement surgery. I'll also answer some of the most common questions, including a timeline of how long it takes to recover from a hip replacement. So, let's get into it. I'm Harvey Sandhu, consultant orthopaedic surgeon at Bath Clinic, part of Circle Health Group, the largest private healthcare provider in the UK with over 50 hospitals across the country. It's worth mentioning that you don't always need surgery to relieve hip pain. Sometimes joint pain can be managed with medication, physiotherapy or steroid injections to help with inflammation. If alternative treatments don't give you enough relief over time, then you do have the option of a hip replacement. Hip replacement surgery is a very successful and common procedure, as it quite literally replaces the damaged joint. Let's take a look at a hip joint. The hip joint is made of two bones, the femur, the thigh bone, and the pelvis. The hip joint is known as a ball and socket joint. The ball is the femoral head, which is the top of the thigh bone, and the socket is part of the pelvis, known as the acetabulum. Arthritic pain is often caused by damage to the lining of the hip joint, called the articular cartilage. Hip replacement surgery, whether it's a total hip replacement, a partial hip replacement, or a hip resurfacing, addresses all kinds of issues with the ball and socket part of the hip joint. The aim of a total hip replacement is to remove the arthritic hip and replace it with a metal, ceramic, or plastic prosthetic joint. This is what a hip replacement joint looks like. This is a metal ball, although I use a ceramic ball in my practice, on an uncemented stem, and this articulates against a new acetabular component, which is in this case a cemented socket in this fashion. Although in my practice I'll preferentially use an uncemented socket, with the type of the components being based upon the patient anatomy and bone structure. Due to the size of the hip joint, most hip joint operations are done as what's called open surgery, where we access a joint through an incision in the skin across your hip, so we have the best possible view and access to where the hip replacement will be fitted. Where possible, we will do the surgery with a minimally invasive approach, which we do routinely here. Do remember that talking to a surgeon about a hip replacement treatment doesn't mean you're committing to surgery. It's simply the chance to understand the various options available to you to help you make the best decision for your unique body. Before you have your surgery, your consultant surgeon will likely suggest some lifestyle changes to set you up for the best possible outcome. Losing extra weight can decrease the risk of complications during surgery and can help you to recover faster after surgery. You'll be encouraged to stay active or be given some physiotherapy exercises to strengthen the muscles around your hip. This is often called prehab and can help you recover faster from surgery and make your new hip feel better in the long term. Alongside this, I would usually discuss with you the sort of food you should eat before surgery, and will let you know whether to make any changes to your medication before going into hospital or following treatment. It's useful to bring in a list of your medications along with you, so your consultant can give you the best advice. Most people will leave hospital after 1 to 2 days, and you won't be able to drive for up to 6 weeks. So we recommend you arrange for a friend or family member to come and collect you from hospital and help you out in the days after surgery. it's helpful to think through all the ways to make your home as recovery friendly as possible and stock up on things like easy to cook food and essentials. Before you leave hospital, you'll be shown how to move up and down stairs, but you'll want to limit this initially if you can. All the details around pre-surgery preparation will be explained in detail to you during your consultation and planning process. Will your surgery hurt? You won't feel any pain during your procedure. The whole procedure will be done under a spinal anaesthetic, so you won't feel the pain. Sedation may also be provided if you so wish, so you're not awake during the surgery. The anaesthetist will also provide long-acting painkillers for several hours to help with the post-operative discomfort. Once you're ready, your consultant orthopaedic surgeon will make an incision on the side of your hip and then begin the process of removing the damaged tissue from the ball joint of your hip. The artificial hip is then inserted. Whether this is a cemented or uncemented type of hip replacement or a fully metal hip depends on the material you and your consultant have discussed which is the best option for you. Minimally invasive techniques are used routinely to aid a swift return to activity. Before inserting your new permanent prosthesis, we'll have first used a test implant to check the measurements are correct and that the new joint moves as it should. We'll make sure the prosthesis fits precisely so your new hip feels natural as possible, works well and has a long life. Once we're happy, we'll close the incision using dissolvable stitches. Your surgeon will use glue or sutures on your skin to ensure a neat and tidy scar. A hip replacement operation, whether partial or total, typically takes 1 hour. After surgery, you'll be taken to a recovery room to be monitored. Then once our team are confident everything has gone well, you'll be transferred to your private bedroom to start your recovery in comfort. I'm often asked, how long will my hip hurt after surgery? And how long will it take to recover from a total hip replacement? Recovery from hip replacement surgery requires your commitment and dedication to make sure your hip recovers as best as possible. On the day of surgery, we will start your rehabilitation and you'll be up and walking with the physiotherapy and nursing staff. The reality is that the first few days will be slightly challenging. Immediately following your surgery, pain and swelling around your hip is normal. We'll advise you on how to reduce this pain by applying heat and various types of medication. Initially, normal levels of pain can sometimes be significant, but it will be different from the chronic pain you were experiencing before your surgery. However quickly, the pain improves significantly. Everyone's recovery timeline is different, as it will depend on your level of fitness before surgery, your everyday activity levels, the nature of your job, and your age. By 1 to 2 days after surgery, most people can get out of bed and walk, though you'll need to use walking aids such as crutches or a walker. Your physiotherapist will be there to help you get out of bed and take your first steps following the operation. Within 2 weeks, you'll be able to walk more regularly, but you will still need to use a walking aid. You can start gentle exercise after 2 to 6 weeks. Going on long, slow walks can really help you build up your fitness and mobility again. You can usually return to work at the 6-week stage if you are desk-based, but if you have a manual or physical job, you will need to factor in more time off. By 6 weeks, most patients are walking without a walker or crutch, and you may be able to drive depending on your progress. 12 weeks after hip replacement surgery, you should be well on the way to a full recovery and able to carry out everyday activities with ease. Full recovery from hip replacement surgery will probably take more like 6 to 12 months, so it's a big commitment to physiotherapy and rehabilitation. I often tell my patients they can have the best surgeon in the world perform the surgery, but if they don't put in the effort with the physiotherapist, the outcome is suboptimal. If you're looking for advice on the best exercises to recover from your total hip replacement, we have more videos on our channel where some of our specialist physiotherapists will give you tips on your recovery from surgery. Don't be discouraged by the initial period of recovery. A hip replacement is first and foremost a pain relieving procedure. That's the main reason to choose any form of joint replacement. Over 90% of people who have a hip replacement are pleased with the outcome, and after a year of treatment can often go through days where they barely remember they've had an operation. So that was a brief run through of what to expect with a total hip replacement. If you want to come and see me for a consultation to talk through your options for hip replacement surgery or discuss any hip problem, you can book online via the link in the description below, or alternatively search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below this video, as we'd love to hear from you. Otherwise, thanks for watching.